Okay, let's start. So good afternoon. Welcome everybody for our fourth Connecting the Dots seminar. In this series of ITM seminars, our partners take center stage to present the new country programs 2022-2026. And the goal of the series is to increase awareness about our actions in the field of scientific capacity strengthening, but also to foster exchanges, of course, across programs, across departments and disciplines, and to stimulate joint learning. We have quite a diverse audience today, partners, ITM staff, but also alumni. And I'm very happy that Dr. Natama from CRUN, Clinical Research Institute in Nanoro, and also Matthijs Mutsars from ITM are joining us today. Matthijs will be the moderator of the session. First, we will have 45 minutes of presentation by Dr. Natami, and afterwards you will all have the opportunity to ask questions. I would like you to put your questions in the Q&A, so not in the chat, and then we can easily collect them and ask them, put them forward. It's also possible to take the floor during the Q&A, so we can unmute you. So just then, please raise your hand after you've put your question in the chat, and then we can always give you the floor to go a bit deeper into your question. Voila. So, but I think we can start. So I would like to give the floor to Matthijs Mutsars to present himself and also the speaker.
Thank you very much, Cedric, for organizing. And of course, thank you, Natama, for being here. I will briefly give an introduction on Natama so everyone is well informed. So Dr. Natama is a biologist by background and associate researcher at the clinical research unit of Nanoro. We call it CRUN, of course, in Burkina Faso. He holds a PhD in Biomedical Sciences from the University of Antwerp and in partnership with the malaria unit here at ITM. His current researches include the vaccinology of malaria, malaria during pregnancy and in infants, and the molecular epidemiology of malaria infections with a great focus on the gametocyte carriage. He is leading the Biomedical Research Lab at CRUN and coordinates the phase 2 and 3 trials of the R21 and Matrix M malaria vaccine, coordinating on top of that also the FA5 program in CRUN. And that's maybe why he's here as well. So please, Natama, friend and colleague, take the floor, because I think with your enthusiasm, the list of activities may be very long. Enjoy, everyone, and welcome, Natama.
Thank you much for this introduction. I'm going to share my screen. Yes. This is a great pleasure for me to present the clinical research unit of Nanoro as part of the ITM partners webinar. And the research center I'm going to present as a story that is closely linked to an ITM alumni, which is Professor Alidu Tinto, who has conducted his PhD at ITM between 2003 and 2006. And at the end of his PhD, he was really motivated to go back in Burkina and establish his research team. And there was some proposition for him to do a postdoc abroad, but his motivations drive him to really come back and try to establish his research team. That was quite a long journey for him, quite challenging. But at the end, as I was presenting this picture with him switching, that was to show how hard it was for him. And also with a big smile, that's, I think, best characterized Professor Tinto. And how the CRUN's story started. So Professor Tinto was based in Bobo-Dioulasso, at the Research Institute of Health Sciences, and also research associate at the Saint-Muras. And he was coming in Nanoro to collect samples since Nanoro was a pilot site for anti-malarial drug resistance studies. So that time there was no staff on site. And in 2009, in favor of the start of the phase 3 trial on the malaria vaccine candidate RTSS, so he created CRUN. And since 2009, 7 years later, regarding the growth of the center, is Institute of Origins, which is the research Institute of Health Sciences. CRUN was erected as a regional direction of the RSS. And from 10 people with whom he created the CRUN, in 2023, we are now about 40 people working with him. So in terms of affiliations, actually we belong to the Ministry of Research and Higher Education, and within the center called Centre National de Recherche Scientifique et Technologique, which is the center coordinating research activities in Burkina, where there are different institutes, and we belong to the Institut de Recherche en Sciences de la Santé. And as I will explain, we have now regional direction of the West Center region, and CRUN is within this regional direction. The clinical research unit of Nanoro is located in a rural area, 85 kilometers from Ouagadougou, where the population is about 166,000 inhabitants. And we have high incisional transmissions of malaria, and this overlap with the rainy season from July to November, with a mean rainfall of 700 millimeters per year. We have two main missions. The first one is to contribute to the formulation and orientation of African public health strategies and programs. And second, to contribute to the training of competent young scientists with solid experience in clinical and biomedical research. Regarding our organizations, Tinto, as regional director and head of CRUN, is supported by an administration and finance service. We have a quality management service, IT and data management service, and a logistics service. And then we have the technical services, where we have the clinic, the pharmacy. We have two labs, the clinical lab and the biomedical research lab, and a health and demographic surveillance system. And on top of that, we have a research and coordination team. Going to our platforms. So the first platform is Nanoro Health District itself, since we are working a lot on clinical trials, and where we have 57 villages, and we establish quite a close collaboration between us and the populations, and also the health district authorities. Within this district, we have 22 peripheral health posts that we call CSPS, 4 CM, which is Centre Medical, and 1 referral hospital that we call Centre Medical avec antenne surgical. And the clinic staff is trained to international standards, ICH and GCP, and we have our staff appointed with the staff of the health district in peripheral health post. The second platform is our HDSS. CRUN has established since 2009, so at the beginning of its story, HDSS, that covers 24 out of the 57 villages, and this is about 65,000 inhabitants under the catchment area of the HDSS, which is in the green part of the Nanoro F district map. And it includes 8 of the peripheral health posts and the referral hospital of the district. And the initial census was in 2009, and we are trying each year to do 2 updates. And we started with a paper-based data collection, but we moved 5 years ago now to electronic-based data entry. That is very helpful. So this is basically the activities of the HDSS. So first, we have field workers who identify the household, and within the HDSS, they have a geographer who geolocalize the household, and then each events regarding birth, immigrations, immigrations, and death are recorded through our updates, but also through field workers and community informers who are reporting us all the events that is occurring in the community. So the third platform is our laboratories. We have a clinical lab, as since we are doing a lot of clinical trials, and the clinical lab is supporting all these activities with the medical checkup of the participant, but also during the follow-up of the different studies. And then with the strategy of being able to do ourselves some basic biomedical research, a biomedical research lab was established, and this was supported by ITM. And other key facilities include the pharmacy, dealing with the investigational product of the clinical trials. We also set up a modern archives to keep in very good and with international standard conditions our paper from the studies, and also the data entry and management team. So going on to our research interests, we have 4 main clinical trials on drugs and vaccines. We are also doing interventional studies, biomedical research on infectious and non-communicable disease, and on health systems. So I have selected some of our ongoing projects to illustrate what we are doing. On vaccines, we are currently working on the new malaria candidate vaccine R21, doing both the phase 2 and the phase 3. But I have later on some more slides regarding these studies. Regarding anti-malaria drugs, we are involved in different the evaluation of anti-malaria drugs to fill different types of gaps regarding availability on the market of anti-malaria drugs. For instance, the first one is to address the gap of anti-malaria treatment in children below 5 kgs. And in the second one is regarding ACTs for pregnant women. And in the third one is to address the challenge of the good observance of the treatment, because most of the treatment are based on 2-3 days treatment with 2 times uptake of the treatment. And in this third study, it's about to assess a drug that could be taken once a day during 3 days. And these are mostly in partnership with some pharmaceutical companies. We are also working on the evaluation of strategies. This first project is about how to improve the IPTP strategy, which is the intermittent preventive treatment during pregnancy with sulfadoxine pyrimethamine, because even though this strategy is in place, a number of pregnant women are reaching delivery with some malaria infections. And here we are assessing if using a ultrasensitive RDTs to detect during pregnancy and treat those pregnant women can improve the reduction of placental malaria and low birth weight. So we are also working on a strategy established for children under 5 years, which is a seasonal malaria prevention with a supplementation of some nutrients for malaria prevention. And these two studies are mainly grants from our young researchers at CRUN. Some of our biomedical research projects, first thing, we are also working on non-communicable diseases within the Asia Africa Consortium, where we are looking at genomic and environmental risk factors for cardiometabolic diseases in Africans. We are also working on the challenge of diagnosis of infectious diseases. Here with the COVID, this project is about to explore diagnostic approaches for COVID-19 infections in West Africa. Regarding malaria, we are assessing if the combination of different available rapid diagnostic tests could be used to improve the management of fever cases, but also testing innovative molecular diagnostics tests for malaria. And more fundamental research are also malaria immunology, looking at immune responses in Plasmodium falciparum gametocyte carriage. To finish with these examples of studies, there was one on COVID when we had the first cases in Burkina regarding our expertise in terms of clinical research. Prosecutor was solicited to conduct this CLORA study aiming to determine the efficacy and the safety of chloroquine and the combination of chloroquine and azithromycin for the treatment of COVID-19 infections. And we also have some of our studies on nutrition, looking at intervention to improve women's health during the preconceptional and postpartum periods, and also improving diagnostics tools for early detection and management of different infectious diseases, including malaria, toxoplasmosis, parvoviruses, and rubella. So now I would like to talk a bit on our contribution on malaria vaccine development, because we think this is one of our valuable contributions in the field of malaria. So in October 2021, WHO has recommended what could be considered now as the first generation of malaria vaccine, which is RTSS, also known as Mosquirix, and which is a vaccine targeting the pre-erythrocytic phase, especially the circumscribed protein antigen of Plasmodium falciparum. And Nanoro was part of the phase 3 trial that was conducted between 2009 and 2013 in 11 sites, 7 countries, and included more than 15,000 children aged 6 to 12 weeks and 5 to 17 months. So at the end of the phase 3, what could be summarized in terms of efficacy is that 36% of efficacy was observed after the administration of 4 doses over 48 months. And for children aged 5 to 17 months, the vaccine efficacy was 56% over 1 year. Even though that could be considered as a modest efficacy, based on the capacity of the vaccine to save millions of lives in Africa or in endemic countries, WHO explore the implementation of this vaccine through trials conducted in Ghana, Kenya, and Malawi. And based on the outcome of this implementation trial, that they recommended the use for children in endemic settings. And then we are involved in the evaluation of a new promising malaria vaccine, which is R21 matrix M. It's quite a biosimilar molecules of the RTSS. And we can see that here, the bioengineering that was developed for the production of R21 allowed to have more CSP protein on the surface of the virus. And the difference is also related to the fact that the antigen HBS of the hepatitis B virus was used both in R21 and RTSS, but in R21 is slowly immunogenic, and while highly immunogenic in the RTSS. And the difference is also based on the adjuvant that is being used. It's the matrix M, a saponin-based adjuvant in R21, and a liposome-based adjuvant in RTSS. To summarize the main outcome, in the phase 2 trial of R21 matrix M, we observed that the vaccine was safe and well tolerated. Over 3 years, with 4 doses of R21, we found an efficacy of 73%, taking into account all the malaria episodes. And when looking at the occurrence of the first malaria episode, the efficacy over the 3 years is 75%. The 4th dose regime showed as high efficacy as a 5th dose. This suggests that after the first booster dose, further booster doses may not be needed. In terms of implementation, that's something very significant. And there was a very high responses to the non-specific antibodies, and this correlates with the protections. So regarding the next step with this malaria vaccine, in the phase 2, we will be evaluating the data after the 6th dose as it was planned in the study, and we'll be able to compare individuals who receive 4 doses versus 5 doses and 6 doses over 48 months follow-up. And we are also discussing to see if an amendment cannot be done to have a long-term surveillance of malaria, of severe malaria, and to exclude any rebound. And in parallel, we were able to, with our partners of the University of Oxford, to move to the next step with the phase 3 that started in April 2021 in 5 sites. In Burkina, there are 2 sites, Nanoro and Dande in Mali, Buguni. In Tanzania, it's Bagamoyo and Kilifi in Kenya. And for the phase 3, there are 2 different types of sites. There are standard sites where malaria transmission is peri-annual, and the seasonal site like in Nanoro. And in total, 4,800 children aged 5 to 36 months have been enrolled. And in terms of dosage, it's the 5 microgram of R21, the 5 microgram of matrix M that showed higher efficacy within the phase 2 trial that is being used in this phase 3. So we completed in January 2023, the 18 months follow-up, and in the coming months, we will have first result of this phase 3 trial. And if the efficacy of phase 2 is confirmed in this phase 3, that will give the opportunity to meet the WHO expectation, which is to have a malaria vaccine by 2030 with an efficacy nearly 75%. So now, what we are done in the past with ITM. In terms of research project, I can illustrate with 4 main ones. The first is the PREGAT project, where we study the safety and the efficacy of ACTs for the treatment of malaria in pregnant women. And the outcome of this project has contributed to the introduction of the use of ACTs for the treatment of uncomplicated malaria during pregnancy. So we also have studies on malaria in pregnancy and looking at new ways in improving current preventive strategies. That was innocent PhD project conducted at ITM between 2008 and 2013. With Titus PhD project also on malaria during pregnancy that was conducted with ITM between 2011 and 2016. And my PhD project looking at inter-individual susceptibility of malaria during the first year of life that are conducted with ITM between 2014 and 2018. We have also conducted quite a number of studies in the field of microbiology, and here is to illustrate 3 studies on AMR. The first one was on antibiotics used in the community in the Nanoro district, and also antimicrobial resistance surveillance using strains isolated from blood culture samples in tropical settings, and also hospital as a reservoir of antibiotic resistance in low resource settings. And within the FA4, we are conducted a project on molecular epidemiology of malaria, which is the in-house determinant of sexual differentiation in Plasmodium falciparum parasite. And this was a longitudinal cohort study looking at factors, host-related factors, erythrocyte variant, hematological parameters, and anti-malaria treatment that contribute to the production of gametocyte, and also to look for the role of host immune responses on gametocyte carriage. And that's a project where we have an example of synergy where I was able to get a career development fellowship from EDCTP to work on the immunological part of this project. In terms of capacity building, firstly, it's the transfer of technology, both by trainings organized on-site in Nanoro or trainings conducted at ITM. If we were able to conduct trainings here, it's because we were supported to set up a molecular biology lab, and a training was organized in 2017 where we invited different young researchers across different institutions in Burkina. And the molecular biology lab was set up within the FA3 and was really used within the FA4 with the in-house project, the molecular epidemiology project. And within the FA4, we were also able to set up a next generation sequencing platform supported by ITM. And the strategy is now within the FA5 to use these platforms. And I will talk about that very soon. So in line with our second mission, which is training of young scientists, Procetito has really put a lot of effort since the creation of CRUN on that. And as you can see, since 2009, we have 14 completed PhD project. And the last one was just 1 week ago in the Netherlands. And here, I just want to highlight 3 main things. The first is that in green here are those who did a PhD with ITM. In yellow are our colleagues who did a PhD here in Burkina, but benefited trainings at ITM. And we also have in blue a colleague who did a master thesis at ITM before moving in the Netherlands for his PhD. The second thing is to build a multidisciplinary research team. And as you can see, we have different specialties in the training of the PhDs. And also the third one is, in addition to ITM and University of Antwerp, we're able to establish some partnership with universities, also in Belgium, UCL and KU Leuven, but also in the Netherlands to support this vision that is to train young researchers. And now we also have 14 ongoing PhD projects. Here, I wanted to highlight how the investment in the training of young researchers has impacted the publication record of Professor Tinto. And as you can see, when he was creating the CRUN, it was about 2-3 publications per year. And with the training of young scientists, we increased the publications record to reach 32 publications since 2020. And interestingly, nearly half of the 14 PhDs were able to attract grants to support the sustainability of what Professor Tinto has built. So now going to the FA5, as I was mentioning, the setup of the NGS platform is to be used within the FA5 by two main activities. The first one is to do malaria molecular surveillance, looking at the resistance markers of Plasmodium falciparum resistance, but also the characterization of parasite population dynamics. And interestingly, we'll be using an in-house assay, and that was set up at ITM, and we will transfer the technology at ITM to conduct this study. And we are preparing to have a training in September, October on that. We want also within the work on AMR to use the same NGS platform for the antimicrobial resistance surveillance. Besides that, we will be working on understanding determinant of AMR drivers in hospital and the community with both microbiology component and socio-anthropology component. We are working in partnership with St. Miraz on the field of improving sexual and reproductive health. And regarding the HGSS activities, ITM has been very supportive for the enhancement of HGSS activities, but also the sustainability, because most of the projects that we are able to get, or the grants that we are able to attract, are not taking into account the daily activities of the HGSS. And last but not the least is the capacity building. And the strategy is regarding all these activities to have PhD students working within the different component of the FA5. And as you can see, we have LOMPO registered at KU Leuven within the FA4 and continuing within the FA5, working on antiseptic, disinfectant, and hand hygiene product as a reservoir of antimicrobial resistance in healthcare facilities in low research settings. And the idea is to characterize antimicrobial resistance profile within these products and assess their clinical relevance. With Adelaide, a social scientist, she's registered at UCL, and at PhD topic deal with understanding antibiotics use through an ethnographic study in rural Burkina Faso. And the main objective is to understand the cultural and the socio-economic conditions that drive antibiotics use in rural Burkina Faso. With Daniel, research at UCL as well, his PhD topic is dealing with the community as starting point of antibiotic resistance, emergent and spread in low research settings, risk factor assessment. And here he will be working to provide a deep insight on antibiotic use, as well as the extent of resistance of E. coli and Klebsiella pneumoniae strains in the community. With Florence, a PhD project is embedded to the in-house project that was developed within the FF4, where she is working to characterize Plasmodium falciparum transmission dynamic in high seasonal malaria transmission settings. She will be looking at factors that are associated with malaria prevalent incidence and gametocyte carriage, but also the genotypic link between parasite population from asymptomatic carriage during the low transmission season and those in the subsequent clinical episode during the high transmission season. And the last one is Edwige. She's a newcomer within this cohort of the FA's programs. We are aiming to get her registered at the University of Antwerp, and she's being prepared for that, where she will be working on how next generation sequencing tools for molecular surveillance of malaria drug resistance could contribute to contribute to the change of malarial drug treatment for the National Malaria Control Program. And we will be mainly assessing the impact of preventive treatment in targeted population, pregnant women, with the IPTP-SP and also the SMC. And we will be also looking at how, what's the level of ACT resistance markers. In terms of perspectives, we already have some on the table with the imetasex project, looking at autoimmune and metabolic determinant of sexual conversions in Plasmodium parasites. And also the last one, introducing a malaria vaccine into a vaccine-hesitant world. That's also already a funded project with CRUN, and that's a socio-anthropology related project. But also we are aiming to develop and evaluate strategy to reduce antibiotic use in the hospital, in the communities. And we have some ideas to look for collaboration with University of Oxford to use R21 vaccine for preconceptional vaccination to protect young women before they get pregnant. This is an overview of our partners. In Burkina, we are working with different research centers and also some organizations and universities as well, different partners around the world, research centers, ITM, the Jena Institute, and also universities. But also we are part of different consortium, malaria and pregnancy, malaria vaccine consortium, and working also with different pharmaceutical companies. And before I finish, that's what I can summarize in terms of what we are doing in Nanoro. And the story, for us, the story of CRUN is a real success story of an ITM alumni with the continued support of ITM that led to what we share with with you today, and hopefully we will continue in that direction for further successes. Thank you for your attention. I'll be happy to take some questions.
Thank you, Natama, for your detailed and very good presentation. I see there are already some questions, if I'm correct, or somebody wants the floor. Not sure.
Not yet, but yeah, don't hesitate, people, to put your questions in the Q&A, or if Anna raise your hand, but I'll...
Hi, Natama.
Hi, Anna.
Presentation. I wanted to ask you, so for the plans of the R21 vaccine, so now that it's going to be tested in the phase 2-3 in other countries, what is going to be the role of the CRUN together with Oxford? So are you going to support the other sides, or how is going to go?
Actually, the other side came on board within the phase 3, because when we conducted the phase 2, there were some questions that we are not able to answer with only one side regarding the differences of malaria transmission intensity, but also the seasonal versus the periannual side. So with our partners, the University of Oxford, we established a collaboration with other research centers. So we are together on board in the evaluation of the R21 in the phase 3.
Okay. And do you know if there is plans to bring the vaccine outside Africa?
For the moment, no, because we are waiting for the first result of the phase 3. And if it's successful, I think the first focus will be to get all the approval and to have the second generation of malaria vaccine, which will be R21. And then from there, I think other option could be explored.
Okay, thank you.
Thank you.
Thank you, Anna. I myself, I also had a question, maybe a more general question. Actually, like with the broad network of postdocs and research projects going on at CRUN, which other collaborators are active in CRUN or are like main collaborators? And do you see any synergies with their projects and those of ITM?
Yes, thanks for your question. Actually, that's one of the main vision of Project Tinto, to explore or to take opportunities of all our projects that we are conducting and to see the links for the training of young scientists, but also in terms of sustainability of what we are doing. And the example could be with the last PhD student that I presented at VISH, where we have a project known as Sendofo, where there were some opportunity to do the PhD, but not covering all the requirement for in terms of budget and also where to be registered. And in partnership with ITM, we are trying to get registered at the University of Antwerp and to work within the FA5.
Okay, thank you, Natama. We had a question of Saskia. Saskia de Kuiper asks, so yeah, indeed, actually quite similar question that I had noted down. So you showed this list of 14 completed PhDs in the past 10 years, which is of course pretty impressive. However, how tries CRUN to retain these very qualified researchers, and is there kind of a strategy to ensure that these new PhD graduates are successful in obtaining the research funding to become PhD graduates, but also maybe postdocs?
Mm-hmm. Yes, that's a good question. Actually, I think Project Tinto had a clear vision of how to have a research environment that is really help for young scientists graduated to come back and establish themselves and try to develop their own research niche. And we have within the CRUN, the main campus based in Nanoro, but we are developing different research stations with research niches different from one to another, where different young researchers can develop their own research activities. But also, the strategy when the PhD come back is to get them to help them to get the job at the Ministry of Higher Education and Research, and there are annually some calls for that, and within our institute they are organized to get small posts for the different research teams, and Tinto is pushing to have some to get the permanent position there. And yes, in terms of being able to attract grants, Tinto is also supportive because I can say it's really a good mentor. From the 14 PhDs, as I said, we have already 8, at least 8 of them were able to attract grants by themselves. So that's something really interesting. And the last thing that I can say, among the 14 PhDs, none of them stay abroad. So we are all back and working with him.
That's great. Are there any other questions so far? Yes, Rafael. I think you're free to speak now.
Can you? Okay. Firstly, it's great to see Natama there. This is a comment of an old lady. I've seen him as a very young researcher in Nanoro, and it's great to see him presenting the Nanoro Center. I don't know if I missed this point because I joined a little bit late, but during FA3 and FA4, Nanoro was really a leader across other collaborating institutions, because it took the leader to organize locally very interested good clinical practices and good clinical laboratory practices training with a very innovative approach, partly theoretically and partly with stage on the field. Then that kind of funding was not given anymore, but I was wondering if this is something you are retaking, or you could retake, because it was really a great way to train people from your side, but also to attract people from for south to south training and capacity building. It was, I think it was unique capacity.
No, I didn't talk about it, and that's really a great idea to reconsider such a training. And as you are in the field of clinical in ethics of the biomedical or clinical trials, you know how researchers need to be trained in that field. And yeah, definitely that's something that we could reconsider to propose trainings on that. Yeah, thank you for pointing out this.
Thank you.
Okay, any other remarks or curiosities on Natama's presentation and the relationship we cherish with CRUN? No. I had actually an extra question, maybe with regard to these synergies. If I remember it well, there is also something in the pipeline with organizing the sequencing capacity in concert with Oxford, that they might also be involved or at least use the sequencing facilities that are now new to CRUN.
Yes, actually, that will be for the AMR surveillance component of the use of the NGS platform, because with ITM, we are quite comfortable with your support to develop those activities, but for the AMR surveillance, we do not. And within the CABU project, we will normally have someone from CRUN train. It will be maybe at the University of Antwerp, because they are part of the work as well, with the support of University of Oxford. Yeah.
Okay, great. Thank you. So, are there any other questions? Ah, indeed, Brecht, it's true. It's indeed with the University of Cambridge, not necessarily Oxford. Yeah.
Okay. Yeah.
Okay.
Okay.
Then I think we had a very good discussion, and thank you, Natama, once again. I give back the word to Cedric to finalize this session.
Okay. Yeah, thanks a lot, Matthijs. Also, thanks a lot, Natama, for this very interesting presentation. Like I put in the chat, we have recorded the session and we will make it available for the colleagues, other staff and partners who couldn't make it today. Also, the previous sessions are available online also for alumni who are interested. I think maybe it's a good idea to already invite you for our next seminars. I'll also put it here in the chat, the upcoming seminars. On the 9th of March, we put Health Benin in the focus. Dr. Dissou Afolabi and Dr. Jean-Paul Dossou will give us some more insights about LRM and CRUN. And then in April, this will be a live session, but also streamed online, where Dr. Teresa Ochoa from the Instituto Medicina Tropical, Alexander von Humboldt, will give us some insights on the program in Peru. So you're all very much invited for the next sessions. Keep an eye on the website. And of course, you will get the invite in your mail. So thanks a lot, everybody, for this interesting debate, and hope to see you for one of the next sessions. Have a great afternoon. Ciao.
Thank you. Bye.